Welcome to Everyday Woman. We have the doctors of Breastlink here to answer all of your viewer questions about breast cancer. We're just going to go ahead and have them introduce themselves and tell us your specialty.
Thanks. I'm Dr. Nimmi Kapoor. I'm a breast cancer surgeon.
I'm Dr. June Chen, and I am a specialist in breast radiology.
I'm Dr. John West. I'm a breast cancer surgeon.
I'm Dr. Justin West, and I'm a plastic and reconstructive surgeon.
Are you two related?
Father and son.
How would you know?
What
was your first clue?
Well, that's good. Well, let's just talk a little bit. I know, some of the questions that people have are, is what I'm eating causing cancer? So I'll ask you, Dr. West, what's the relationship between diet and breast cancer?
Well, it's a bit indirect, and I think it's kind of a complex subject. You get different answers, but I think one thing we know, there are some ways to lower breast cancer risk, and we know that obesity is definitely a risk factor. We know exercise lowers risk of breast cancer. But probably there are diets that are more effective. The high carbohydrate diet is probably a bit of a risk factor, but maybe Dr. Kapoor, she's much more in tune with some of the scientific literature than I am, but that's kind of the picture.
Absolutely. We recommend a low-fat, high-fiber diet, a healthy diet, basically, and that's really important.
Well, I've been seeing on Facebook, there's some posts going on basically telling people that if they eat a certain diet, they won't get breast cancer, or they can avoid chemotherapy if they do. Is that accurate?
I think in the media, there's a lot of, you got to take some caution with what you hear and read about in the media. We know that excess green tea 3 times a day can actually help reduce the risk, but specifically, I don't think there's anything else really that would.
I've seen that alluded to. I'm very interested in the issue of nutrition and trying to get a basic understanding, because we really should know more about it than we do, but I don't think there's conclusive evidence. And sometimes on Facebook and website, you get claims that are hard to substantiate because nobody's really, you can say pretty much what you want to say. So when Dr. Kapoor is kind of a rigid scientist, she's not going to go along with anything unless the data is really solid. And that's the way a physician, really has to.
Well, and that's what I want to know about. I mean, is it just, people who, are eating whole foods, which is great, and, really conscious about their diets, are they saying it's a cure rate for everything, or is there really research behind it? So, it sounds like the jury's out a little bit.
Well, no, we do know that the healthier diets are definitely do better for our breast cancer patients and for prevention. So that is definitely.
But it can't necessarily prevent it if you are having patients with breast cancer.
Sure.
Okay. Well,
I think that an important point also is that studies have shown that we should reduce the amount of alcohol intake in women. So it has been recommended that women drink no more than 1 alcoholic drink per day. And that is beneficial in reducing your risk for breast cancer.
And you shouldn't save up all your drinks for the day for Saturday and have 7 that day, right? That doesn't
probably
quite
not
work
a good
either.
idea.
Okay. Well, obviously we're trying to encourage women to get an early diagnosis, to be aware of their breasts, to do the self-examination. If they have an early diagnosis, if they do catch something, what's the survival rate?
Extremely high. I mean, this is why we really, really want women to get their mammograms on time, so that if we find a cancer, we find it as early as possible when it's the easiest to treat.
Well, I think some of the hardest part about this, there are women who are diagnosed with breast cancer, and they're strong. They can handle it. I think the hardest part is if they have families that they have to tell, especially if small children are involved. How do you work with families on helping them, tell their small children what's going on and what they can expect?
Dr. West has developed this wonderful support group, and I think you should really talk about that. It's really...
Well, thank you. We find that you almost can't give a person enough support, and everybody varies tremendously on their needs. So the young women with young children is a special example of the challenge and knowing when to tell them. I think my general feeling is to answer their questions at whatever level you can, because if you don't say anything and there's a lot of anxiety, they feel that anxiety, so they want to feel part of it. But you have to individualize, and there's just different relationships, and we just encourage them to talk about it. Our volunteers share their ideas about it. We have support groups where they bring up this issue. So I think the nice thing about Breastlink is like a family between the patients we've operated on before. They come back and support our patients, the physicians that are very sensitive to this kind of issue, our nursing staff that supports them. So the more dialogue you have, the more individual attention you give them, I think the easier you can make this. But it's a challenge.
Yeah, we encourage our families, our patients, to bring their families with them, bring their help with them, so that we have a council and a group for them as their support.
Okay, and maybe, the kids can come to a
Definitely.
mammogram or any of the other treatments. I mean, is it good to kind of get them involved so they feel proactive as well with kids? I guess it depends on the age.
I think it depends on, exactly. You have to individualize. I don't think you can make rules, but the moms and dads, have that relationship. They can talk. I think the thing is you want to answer the questions at the level, mom has a growth or a little lump or whatever, and the doctor's going to take care of it. Is all you really need to say. That's all the real young ones want to know. And they're not really interested in going much more than that in general. But I think if somebody has a lot of questions, you answer a lot of questions as best you can.
Okay. Well, let me just ask a little bit about the difference between a lumpectomy and a mastectomy. When do you choose one over the other?
Go ahead.
It's a very personal decision, and there's no right answer for any patient. A lot of it depends, number one, on how big the cancer is and what needs to be done to treat the cancer. And the other part is a big discussion about what the patient wants and what the best cosmetic outcome would be also. So it's both a cancer question, a cosmetic question, a personal question.
Okay, well, we obviously have so many more questions for all of you, and please keep all of the education that you're doing. We really appreciate you coming out here and doing that. For more information, you can visit the doctors at Breastlink.com.